Good afternoon, everyone. My name is Linda Hughes. I'm Chair of the Alberta Health Services Board, and I'm happy to welcome you to this public board meeting. Today's meeting is the final one in our 2017-18 fiscal year, and I'm pleased to report that AHS will end the fiscal year with a balanced budget. Albertans expect many things from AHS, including responsible financial stewardship, so I commend Dr. Verna Yu and all her teams for focusing on delivering high-quality care while operating within our budget. The board knows this can be a difficult balancing act, and we appreciate the efforts of everyone from the executive team right down to the front lines for helping us do our very best for Albertans while keeping our budget in balance. Before I move to the agenda, I would like to quickly note one other recent achievement. Last month, Alberta Health Services was named one of the top employers for young people for 2018 and one of Alberta's top 70 employers. This recognition came 2 months after AHS was named for the first time one of Canada's top 100 employers. I know many teams within AHS have been working hard to improve our workplace environment and culture and to ensure our people feel safe, welcomed, and valued at work. AHS competed against thousands of other employers across the country for this recognition, so to land in the top 100 is really a big deal for us. This recognition confirms our efforts to make AHS a better place to work, and we will continue to work towards improving that every year. It's also good news for Albertans. As the top employer, recognition should help AHS attract and retain the best and brightest healthcare talent to our province. So to everyone involved in our workplaces and to everyone involved in applying for this honor, well done and congratulations. Now on to today's agenda. Before I pass over the mic to Dr. Verna Yu, has everyone seen the agenda? Could I ask someone to move approval? Glenda? Second? Brenda? Great. Declaration of conflict of interest. Does anyone have a conflict of interest you'd like to declare at this time?
Madam Chair, I have a potential conflict on item 8B, the HSAA agreement. I have therefore excused myself from all discussion at the board on this matter, and I will abstain from voting.
Okay, thank you, Hugh. You've all seen the minutes from our December 6th and February 16th meetings. Would someone like to move approval of those? David? Second, Hugh? All in favor? Carried. Thank you very much. All right, over to you, Verna.
Thank you, Linda, and good afternoon to everyone. It's good to see everyone here at 7th Street Plaza, and I'd like to also greet those watching through Facebook Live. While Linda mentioned that this is the final public board meeting of this fiscal year, this time of year also reminds me that AHS is approaching another birthday. We will be turning 9 years old as a healthcare organization in a few days on April the 1st. Over the next year, we will be celebrating on our organization's accomplishments as we near our first decade. And certainly I believe there's a lot to be proud of. Linda's mentioned the top employer recognition, and that really underscores how far we've come in terms of being an organization that treats its people well. Allow me to share a couple of other achievements worth noting. Recently, 5 research teams supported by our 2 medical schools in Alberta, Alberta Health Services and our strategic clinical networks, gave presentations in Ottawa as part of their application for funding under a new program from the Canadian Institute of Health Research. The target was that each province was going to get the green light to proceed with 1 proposal. Alberta didn't get development funds for just 1 proposal, but they got funding for 3, because the funding agency knew that our provincial scale can make large impacts happen. Another achievement relates to our efforts to slow the rate of growth for factors that drive both our expenses as well as pressures on our healthcare system. We think of it as bending the upward curve. Generally in healthcare, expenses and demand for service curve goes upwards, but our curve is actually going down. So we are bending the cost curve downwards. We're working to make these trends where there's a price tag attached to every patient that's receiving care in a hospital bed, and AHS is succeeding in slowing the annual growth of these inpatient days. The total number of inpatient days continues to rise each year, but at a much slower, more sustainable rate than it did before AHS was formed. That's a good achievement in itself. But I'm very excited about areas where AHS isn't just bending the curve, but where we've actually bent it. So for instance, over the past 3 years, the number of total emergency department visits has gone down. Given our population growth, that's really quite amazing, but also points to our partnership with our primary care colleagues. And in my eyes, the most exciting and significant achievement is in the area of cost of discharge. The cost per discharge is the average cost it takes to treat a patient in hospital. Before AHS was formed, cost per discharge after accounting for patient complexity and inflation was rising by 3.4% annually. Over the past 3 years, the cost has been in decline, dropping about 1% a year. So think about that. Since 2014-15, when adjusting for inflation, the cost to treat a patient in hospital, even when factoring in patient acuity and complexity, has been going down and not up. This is a position that many health systems are envious of, and we've done so through a steel-eyed focus on quality improvement. We are not bending the cost curve because we are compromising quality, and in fact, quite the opposite. We're bending the cost curve because in part we're focusing our efforts on helping Albertans stay healthy and giving them the most comprehensive services possible when they are in our care. High-quality, comprehensive care ultimately saves us money through savings accrued through fewer complications, fewer readmissions, shorter hospital length of stay, and reduced need for hospital and inpatient care, to name just for a few examples. And of course, metrics don't define achievement, people do. And at AHS, we have amazing people, staff, physicians, volunteers who make a difference in the lives of people we serve each and every day. I'd like to show a video profiling 2 of these amazing people.
We'd certainly be able to provide health services if the volunteers weren't here, but what it adds to the quality and the patient-family-centered care is just absolutely outstanding. I talk to Helen in the tuck shop because I go there regularly because I love to see her smile, and I just marvel at the fact that she has the energy that she has. Everyone who goes into the tuck shop has a little visit with her. You can't leave without getting a smile. Violet has been a volunteer since she was 3 months old. And what that did to individuals on our long-term care unit, when they see a baby, it brings back so many memories about their life and their experiences. And Violet was just the percolator for all of those feelings.
She gave one resident quite a big hug, and the resident started crying and said, "That's the nicest hug I've ever gotten." And we all kind of teared up in the room, but it's kind of those moments that make it worth it.
There would be a hole in our facility if we didn't have Violet and Helen as part of our team.
Happy birthday, dear Helen, Helen. Happy birthday to you, and many more.
I kind of want to instill in my daughter this feeling of empathy. Even though she's only 2, she knows when she puts the red vest on, then it means I'm going to the hospital to volunteer.
Why do you think you like to volunteer at the hospital?
Just that gets me out.
Gets you out, that's right.
I think that saying thank you almost seems hollow when you look at all the things that volunteers have done, specifically Helen and Violet, that saying thank you really means that from the bottom of our hearts, we are so grateful for what they bring to the fabric of what we try to achieve at the Canmore Hospital.
So I'm very grateful for Helen and Violet and 14,800 other volunteers of all ages around the province. Helen and Violet have a lot in common, aside from one little fact that there's nearly a century of living between them. This is just a sneak peek of one of the videos. We'll be sharing it with Albertans during National Volunteer Week that starts April the 15th. As Barb says in the video, volunteers play a crucial role in AHS and contributed more than 1.1 million hours of service last year. Volunteers are also an example of Albertans partnering with us to improving patient and family experiences with the healthcare system, helping AHS achieve our vision of healthy Albertans, healthy communities together. I'd like to thank our volunteers, and I hope they suitably are celebrated during National Volunteer Week. So thank you very much for your time today, and have a good afternoon.
Thank you, Verna. All right, moving to the business portion of our meeting. Over to Hugh to report on some shareholder resolutions.
Thank you, Madam Chair. AHS is the sole shareholder of Calgary Laboratory Services Ltd. The HAS board has been asked to approve 3 motions related to Calgary Laboratory Services. First, by resolution dated April 16, 2015, the official administrator of AHS delegated to the AHS president and CEO, together with the power to subdelegate, the authority to approve and sign resolutions and certain agreements on behalf of AHS as sole shareholder of Calgary Laboratory Services. The board wishes to revoke the delegation. Accordingly, I move that the Alberta Health Services Board approve the revocation of the delegation of authority dated April 16, 2015 by the official administrator to the President and Chief Executive Officer that gave the President and CEO, together with the power to subdelegate, the authority to approve and sign the resolutions and certain agreements on behalf of Alberta Health Services as sole shareholder of Calgary Laboratory Services. I so move.
Seconder, Marlis? All in favor? Carried, thank you.
Thank you. Second, the Calgary Laboratory Services Board approved amendments to the amended and restated bylaw number 1, the bylaw. The amendments provide, first, that the minimum and maximum number of directors be amended to provide for a minimum of 1 and a maximum of 12, and 2, for a description of the CEO role, and 3, that the word chairman be replaced with the term board chair. Pursuant to the provisions of the Business Corporations Act, Alberta, the shareholder of CLS is required to confirm the shareholder approved amendments to the bylaw. In addition, the Articles of Incorporation of Calgary Laboratory Services will be required to be amended to reflect the new minimum and maximum number of directors. Accordingly, I move that the Alberta Health Services Board, 1, confirm the amendments to the amended and restated bylaw number 1 of Calgary Laboratory Services as approved by the Board of Directors of Calgary Laboratory Services, and 2, approve the amendment to the Articles of Incorporation for Calgary Laboratory Services that reflects the new minimum and maximum number of directors, and direct the AHS Corporate Secretary to execute and file the same with the Corporate Registry Office. And I so move.
Thank you. Could I have a seconder? David, all in favor? That's passed, thank you.
Third, the Calgary Laboratory Services Board considered and supported the appointment of Dr. Garnet Horn as a director to the board. Under the provisions of the Business Corporations Act, Alberta, the sole shareholder of Calgary Laboratory Services shall appoint directors to the board. The AHS board also has considered and supports the appointment of Dr. Horn to the CLS board. Accordingly, I move that the Alberta Health Services Board approve the appointment of Dr. Garnet Horn as a director of the Calgary Laboratory of the Board of Calgary Laboratory Services Ltd. Effective March 26, 2018. I so move.
Seconder, Glenda, all in favor? Thank you. It's carried.
Finance Committee.
Thank you, Madam Chair. Finance Committee met on February 7, March 1, and March 14, 2018. First 2 meetings were full agendas. The third meeting was to consider the quarterly performance report. Committee considered 5 items for recommendation for approval of the board. First, the third quarter investment report. As mandated by AHS investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. The Regional Health Authorities Regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS investment decisions. The committee was presented the December 31, 2017 third quarter investment report and recommend that the board ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below, and as certified by signed investment compliance certificates from AHS and Phillips Hager and North Investment Management. A, as at December 31, 2017, AHS held restricted and unrestricted funds managed by Phillips Hager and North Investment Management and Manulife Financial totaling $1.546 billion. B, funds were invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended December 31, 2017 were invested in accordance with the investment bylaw and investment policy as certified by signed investment compliance certificates from AHS and Phillips Hager and North.
Could I have the seconder? Brenda? All in favor? Thank you, that's passed.
Next, the committee considered 3 agreements. In all 3 cases, the committee recommended the board approve the agreement. First agreement was the renewal and amendment to the current agreement with Sodexo Canada Ltd. The total agreement has a combined commitment value of greater than $90 million. Sodexo provides contracted housekeeping services to acute AHS facilities in the Calgary and South zones. The agreement had a renewal option, which AHS would like to exercise. Accordingly, I move that the Alberta Health Services Board 1, approve a 2-year renewal and amendment to the current Sodexo Canada Ltd. agreement, and 2, delegate signing authority for the renewal and amendment to the AHS President and CEO.
Thank you. Seconder? Brenda? All in favor? It's passed. Thank you.
The second agreement is a contract award to Paladin Security Group Ltd. to provide contracted security services to AHS. Total contract award value is estimated at greater than $90 million for the initial term of the agreement. Finance Committee reviewed the terms of the contract and recommended it for board approval. Accordingly, I move that the Alberta Health Services Board 1, approve a contract award to Paladin Security Group Ltd. to provide contracted security services to AHS, and 2, delegate signing authority of the contract to the AHS President and CEO.
Seconder? Marlis? All in favor? Thank you. It's passed.
The third agreement was the amended and restated Master Services Agreement with Bethany Care Society and amending agreements. Finance Committee reviewed the terms of an amendment to the current agreement and recommended board approval. Accordingly, I move that the Alberta Health Services Board 1, approve the amended and restated Master Services Agreement with Bethany Care Society. 2, approve amending agreements to add service schedules and amend existing service schedules with Bethany Care Society. And 3, delegate signing authority of the amended and restated Master Services Agreement and amending agreements to the AHS President and CEO.
Seconder? Glenda? All in favor?
And as a final matter, the committee considered an authorization for expenses for AHS from April 1, 2018 to June 15, 2018, if the 2018-2019 budget for AHS is not approved by April 1st. The committee recommended that the board approve the authorization for expenses. Accordingly, I move that the Alberta Health Services Board authorize AHS to incur 1, maximum expenses of $3,225 million for the period April 1, 2018 to June 15, 2018, and 2, maximum capital expenditures of $120 million for the period April 1, 2018 to June 15, 2018.
Thank you. Seconder? You? All in favor? Oh, that's passed.
Thank you, Madam Chair. The Audit and Risk Committee met on March 1st, 2018. Standard practice is that the Office of the Auditor General and KPMG are guests at the meetings in their role as external auditors of AHS. The committee discussed various audit matters, including a draft of third quarter financial results, semi-annual report on the status of all outstanding internal and external audit recommendations, an assessment framework regarding strategic clinical networks, an enterprise risk management quarterly summary risk report, and the current status of insurance for AHS. There are no items that came through the committee for board approval.
Thank you, David. All right, next is Governance Committee. Hugh?
Thank you, Madam Chair. The Governance Committee met on February 12th of 2018. The committee received a verbal update with respect to Accreditation Canada assessment and the leadership and governance standards, as well as details as to the planned survey methodology. The committee was provided a table of the results for the AHS Board Skills and Competencies Matrix Questionnaire. The committee also met with the Ethics and Compliance Officer. Finally, the committee discussed the board member remuneration, expense reimbursement, and ongoing education procedure, also known as the procedure. The committee recommended that the board approve the procedure. Accordingly, I move that the Alberta Health Services Board approve the board member remuneration, expense reimbursement, and ongoing education procedure, the procedure, as reviewed by the Governance Committee and the AHS Board. I so move.
Thank you. Seconder? Marlis? All in favor? Thank you. That's passed. Now we move to Community Engagement Committee.
Thank you, Madam Chair. The Community Engagement Committee met on February 12, 2018. The committee was pleased to welcome Ms. Joyce Law, CEO, University Hospital Foundation, Mr. Jim Brown, Chair, University Hospital Foundation, and Ms. Nicole Merrifield, Director, Communications and Special Projects, University Hospital Foundation, to the meeting to discuss the work being done by the foundation. The committee appreciated the discussion they had with Ms. Law, Mr. Brown, and Ms. Merrifield. The committee received an update on community engagement and foundation relations, including the ongoing work with respect to the LGBTQ Provincial Advisory Council, a discussion around governance for health foundations in the province, and an update on the community engagement strategy with respect to the Southwest Edmonton Hospital. The committee also considered 3 items for recommendation for approval of the board. First, with respect to appointment of trustees to foundations, the responsibility to appoint trustees to establish a foundation lies with the AHS board. Continuing foundations, those existing prior to the first provincial regionalization in 1995, and exempt foundations, those created under alternate legislation such as the Societies Act, are permitted to appoint their own trustees without AHS approval, though AHS is able to appoint 1 voting trustee to each continued foundation. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care in the province. Given the number of appointments, the names will not be read in this meeting, but will be incorporated within the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations as reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. Seconder? Glenda? All in favor? Carried.
Second, with respect to the appointment of a member to the Cancer Provincial Advisory Council, under the amended bylaw for the Cancer Provincial Advisory Council, the board is required to approve appointments of members. Again, we are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to healthcare in the province. Accordingly, I move that the Alberta Health Services Board approve the appointment of Mr. George Andrews for a 3-year term to the Cancer Provincial Advisory Committee. I so move.
Thank you. Seconder? Heather? All in favor? Pass. Thank you.
Third, with respect to the appointment of a chair of the Seniors and Continuing Care Provincial Advisory Council, under the bylaw for the Provincial Advisory Councils for Senior and Continuing Care, the board is required to approve the appointment of the chair. Accordingly, I move that the Alberta Health Services Board approve the appointment of Mr. Ray Clark to the position of chair of the Seniors and Continuing Care Provincial Advisory Council for a period of 3 years, with the option to renew for an additional 3 years, according to the bylaw for the Provincial Advisory Council for Seniors and Continuing Care. I so move.
Thank you. Seconder, Hugh? All in favor? Thank you. Human Resources Committee, Marlis.
Thank you, Madam Chair. The Human Resource Committee met on February 28, 2018. The committee received a standing quarterly report on our people results and a labor relations update. The committee received an update on the non-union exempt employee compensation. As well, the committee heard of a very successful safety initiative at the University of Alberta Hospital Neurosciences. There were no items that came through the committee for board approval, but I have been asked to present the following item for board approval. AHS and HSAA reached a tentative agreement for renewal of the AHS-HSAA collective agreement on February 24th, 2018, also known as the collective agreement. The board has considered and discussed the tentative agreement for the AHS-HSAA, particularly the paramedical professional technical collective agreement, and presented to the board. The board wishes to ratify such recommendations. Accordingly, I move that the Alberta Health Services Board, 1, ratify the tentative agreement for the AHS-HSAA paramedical professional technical collective agreement, and 2, authorize the Alberta Health Services President and CEO to execute all such documents and do all such other acts as may be necessary to give effect to the above resolution.
Have a seconder? Brenda? All in favor? Well, thank you, and I note that Hugh, you abstained. Thank you. Thank you for that. Thank you, Marlis. And finally, Quality and Safety Committee.
Thank you, Madam Chair. The Quality and Safety Committee met on March 14th, 2018. We received an update on the health outcome improvement strategic initiatives. We also received quality summary reports, as well as a draft of the Alberta Health Services accreditation status and activities for health facilities and programs annual report, and we were asked to recommend them to the board for approval. The committee considered the reports and for recommendation for approval to the Alberta Health Services accreditation status and activities for health facilities and programs annual report. Ministerial Directive D5-2008, mandatory accreditation in Alberta's health system, requires Alberta Health Services to provide information on accreditation activities and outcomes and accreditation status in an annual report to the Minister. Accordingly, I move that the Alberta Health Services Board, 1, approve the Alberta Health Services accreditation status and activities for health facilities and programs annual report, the report. 2, support the board chair delivering the report to the Minister of Health by March 31st, 2018, and 3, direct management to make the report available on the AHS public website as soon as practical. I so move.
Seconder? David? All in favor? Passed. Thank you.
I have also been asked to present the following item for board approval. The terms and conditions related to the non-academic work Alberta resident physicians perform is governed by an agreement that is negotiated between their association, PARA, and the AHS University of Calgary Cummings School of Medicine, University of Alberta Faculty of Medicine and Dentistry. A new PARA agreement incorporating previously agreed upon non-monetary items and arbitrated monetary provisions has been prepared and signed off by the respective organizations and is required to fully execute the agreement. Authorization from the AHS Board is required to delegate authority to the AHS President and CEO to execute the PARA agreement. Accordingly, I move that the Alberta Health Services Board delegate authority to the AHS President and CEO to execute the PARA agreement on behalf of AHS. I so move.
Thank you. Seconder? Hugh? All in favor? Thank you. That's carried. And I think that brings our meeting to a close. Thank you very much. Good afternoon, everybody.